33-year-old Parisa has worked as a nurse at this hospital in western Tehran for the past 10 years. She likes nursing and wants to continue, but not in Iran. She says working conditions here are too hard.
Our shifts are too long. They are 12 or 18 hours long, and we should do mandatory overtime because the hospital is understaffed. Despite all the hard work, our salary is not good at all. My income is much lower than what it used to be 10 years ago.
Parisa is planning to immigrate to Britain. She says many of her peers are making other plans.
Many nurses are changing their professions. Some move to totally unrelated occupations, others choose beauty or skincare jobs, and many others migrate in search of better working conditions.
Hospital officials say loss of human resources is hampering their work, but they cannot do anything about it, as a nurse could potentially earn up to 10 times their current salary after migration.
Out of around 250 nurses at this hospital, 15 migrated last year and 30 more are in the process of migration. And replacing them is not easy.
Official figures also show 15% of nurses quit their jobs last year. Officials acknowledge more needs to be done to provide incentives to attract and retain talented individuals in the profession. They say the country needs at the very least a staggering 100,000 more nurses. That's why the report says only 8,000 nurses were recruited last year. With each nurse quitting, a further burden is put on the remaining nurses, and the workload is piling up. The vicious cycle continues and more nurses begin to look overseas. And it's not just about heading to the Western world. Neighboring countries are now among migration destinations for Iranian nurses.
It takes at least 16 years to train a nurse. Each nurse completes a 4 to 6 year course in nurse education, and the quality of education in Iran is acceptable. Every country would welcome such a trained and experienced workforce.
Iran's economy has nosedived under years of Western sanctions. That has been a major reason for cash-strapped hospitals to cut back on salaries. Keeping their resources at home has proven a serious challenge for a government being bled dry. Reza Hatami, TRT World, Tehran.